This video will discuss how we will manage a COVID positive or rule out patient in the operating room at Harborview. There will be a step-by-step guide on how to don and doff the proper PPE to take care of these patients. If surgery is required for a COVID positive or rule out patient, they will have their surgery in OR 28. Due to the potential for aerosolizing procedures in the OR, all staff are required to practice airborne respirator contact precautions. This means you will wear an N95 if you've been fit tested in the last 12 months, or a PAPR unit. If you're wearing an N95, you'll need to wear eye protection. You'll wear a contact precautions gown and gloves. While the patient is in the OR, traffic into the operating room should be minimized and only essential personnel should be in the room. Your doffing begins in the operating room, where you will find a dirty PPE bin, Sani wipes, and a sign to the doffing exit door. To minimize traffic in and out of the operating room, please utilize the cabinet pass-through doors for incoming and outgoing supplies. Fit the PAPR hood by placing the gray headpiece on your forehead and the elastic around your chin. It should be comfortable but snug. The OR shroud will drape over your shoulders and be placed underneath your gown. The OR shroud should be reserved for the anesthesia staff working at the head of the bed and the scrub and surgical team working at the sterile field. The standard hood should fit in the same fashion. If you're wearing the standard hood, we ask that you wear a surgical mask in the operating room to help protect the sterile field. Alright, we are going to check our PAPR device. The first thing you're going to do is grab a battery and press the test button to check the charge on the battery. We're looking good when we got all green. Each block symbolizes 2 hours of charge time. You'll connect it to the device and make sure you hear a click. And we're ready to check our airflow. You'll use the meter on the top drawer of the airborne cart, connect it to the hose port, and turn the machine on. When the airflow starts, you're looking to see that the red indicator ball goes above the black line. This is a good sign, letting you know that your airflow is properly working. We'll take the meter off and then proceed to obstruct the airflow. What we're looking for here is an alarm sound. It may take a minute, so just be patient. This sound will alarm when the airflow is obstructed or when your battery is low and you need to change it. There it is. Now that our checks are complete, you can turn the machine off and get ready to attach the hose. So we're looking for the end with those two little silver pointy things, and we're going to match it up with the notches and give it a little twist. Tug on it to make sure that it's secure, and the other end of the hose will attach to the back of the PAPR hood. You'll push it in and hear a little click, and now your PAPR hood is ready to put on. We don our PAPR hood on first, and then get the device around our waist, secure the clasp, and adjust it so that it is comfortable but snug. Jessica, the trained observer, will be assisting Sasha while she's doing so. Sasha is going to perform hand hygiene and get her contact gown on. If you were scrubbing in for surgery, you will skip the gowning step at this point and have your PAPR hood and go into the room where you will get gowned and gloved. Make sure that your gown is tied in the back, not in the front. And Sasha will enter the room using the door on the left, the entrance door, which is opposite the doffing exit door on the right. Before you begin to doff your PPE, please read through all the steps carefully. You'll want to make sure you follow all the steps to decrease the risk of contamination to yourself. Your trained observer will meet you in the doffing zone outside of the OR to help assist you and watch you during your doffing process. When Sasha's ready to leave the room, she'll have clean gloves on and grab a Sani wipe. She'll wipe down the doffing exit door handle. She'll throw that away and perform hand hygiene over her gloves. Before she takes off her gown, Sasha will face the patient and proceed to start at her waist to pull the gown forward towards her. Carefully reach up towards your shoulders and try not to fling anything by rolling your hands in. This can be a little tricky. There we go. Roll your gloves into your gown and throw it into the dirty PPE bin. Perform hand hygiene and exit the doffing exit door into the blue doffing zone. The trained observer's sole responsibility is to guide the healthcare provider as they don and doff their PPE. Checklists like these will be available so the trained observer can read them as the healthcare provider doffs and dons their PPE. On exit, Sasha will perform hand hygiene and meet her trained observer, Jessica, in the doffing zone. Please note the trained observer should be donned in droplet contact precautions, but for purposes of conserving PPE, Jessica is just wearing gloves. The trained observer will hand the healthcare worker a new set of gloves after performing hand hygiene. Jessica will begin to wipe down her PAPR hood and machine. To do this, she will start with the hood and do back to front, one wipe per swipe, ensuring that the disinfectant stays wet on the hood. You'll want to keep the machine on so that the healthcare worker still has air blowing. For purposes of this video, we didn't use multiple Sani wipes, but you get the gist. One wipe per swipe, being careful not to touch the healthcare worker. Next, Jessica will begin wiping down her PAPR hose with a Sani wipe, and again, one wipe per swipe and throw out. She'll begin to wipe down the PAPR machine and grab another Sani wipe to wipe down her belt. Ensuring that she gets every little piece of it. We will now begin to remove her PAPR hood. Please read the instructions before proceeding. As the healthcare worker faces the door, the trained observer will detach the hose, hold onto the PAPR machine as the healthcare worker unclasps the machine. The trained observer will put it onto the doffing cart. After performing hand hygiene over her gloves, the trained observer will lift the lid of the yellow PAPR bin for the healthcare worker. Sasha will carefully remove the PAPR hood off of her head, being careful not to touch her face. She will remove her gloves and then perform hand hygiene. The process for leaving the OR is the same if you have a surgical mask or N95 on. After receiving clean gloves from your trained observer, perform hand hygiene. Carefully reach for the sides of your eye protection, lean over the trash bin, and carefully place into the bin. Perform hand hygiene. To undo your mask, carefully reach behind and undo the bottom tie first. After performing hand hygiene, carefully reach behind you to undo the top tie. Lean over the trash bin and carefully place into the trash bin. You can remove your gloves at this point, perform hand hygiene, and you're all ready to go. This information is current as of March 23, 2020. For additional information, please visit the HMC Infection Prevention and Control intranet page.